Currently, the process of managing mental health in Canada is through medication and therapy, often in combination. Psychiatric disorders such as depressive disorders, bipolar disorder, and anxiety disorders are treated in this form. What I see as a new and growing field in which mental health is drastically being changed is in psychedelic-assisted psychotherapy. Classic psychedelics such as mescaline, LSD, psilocybin, and DMT are on the rise in psychological and pharmacological research for their benefits in addressing mental health concerns. Alongside such psychedelics, ketamine and MDMA, which are also being studied by various organizations such as MAPS, who are in the process of presenting research to federal bodies so that such psychedelics can be present legally in therapeutic settings. Within the next few years, there will certainly be an increase in psychedelic assisted psychotherapy. The results that are being found through research are yet to be fully understood, but very profound. Groundbreaking studies have been done within the past decade. For example, Dr. Roland Griffith and colleagues administered a low and high dose of psilocybin to 51 cancer patients with life threatening diagnosis. Now, as expected, cancer patients who are facing the possibility of death are certainly likely to have high depressive symptoms. What we see in the experiment is that with one dose of psilocybin in a therapeutic setting, 80% of participants saw a clinically significant decrease in depressive symptoms, and this was maintained after a 6-month follow up. Imagine a magic pill that can cure depression. This was seen to be a dream, an impossibility. But psychedelics have poked some holes in there. With that being said, little is understood about how psilocybin affects the brain and changes mood, perspective, and behavior. The participants reported mystical and spiritual experiences which were attributed to change in mood and life satisfaction. There's a variety of questions that are unanswered. What are the neurophysiological effects? What is the role of religious and spiritual experiences in relation to mental health? And how do such drugs affect systems in the brain? I believe psychedelic assisted psychotherapy is the future of mental health. Soon, such psychedelics will be used to treat veterans with PTSD, individuals who have experienced trauma, and individuals with treatment resistant depression, ADHD, PTSD, and anxiety. Maybe we may even see such psychedelics become commonplace, in which people across the country can go into clinics, be supervised by professionals, and take such drugs for self growth and to understand themselves better. I believe psychedelics is the key to understanding not only mental health, but what type of psychotherapeutic measures help with mental health recovery, as well as will help us better understand human consciousness.